Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for returning for another segment. We're going to be speaking with Dr. Jennifer Louie. She's joining us here as a Go Red for Women volunteer to talk about how heart disease is the number one killer of new moms, with nearly 45% of women in their 20s and up living with some form of cardiovascular disease, and less than half of U.S. women having good heart health as they enter pregnancy. Welcome to Health Professional Radio, Dr. Louie. Thank you so much for joining us.
Hi, Neil. Thank you for having me.
Tell us a bit about who you are, your practice, your area of expertise, and especially your work with Go Red for Women.
Yeah, so I'm a cardiologist at the University of Pennsylvania, and my clinical focus is taking care of women with heart disease or heart disease risk factors. And I particularly focus on taking care of pregnant and postpartum women, which is a really fun part of my job. And in addition to my clinical work, I also am a researcher. I'm a scientist, and I study how to reduce heart disease in pregnant and postpartum women. And so as a volunteer with Go Red for Women, I have a couple of different roles. One role is that I help increase awareness of heart disease by encouraging women to understand their risk factors and understand the tools that are available to improve their health. And I get to do that both in my clinic, but also as a volunteer at local community events and doing different types of media outreach. But I also volunteer as a scientist, and so I'm involved in the research that Go Red for Women supports, and I help translate those research findings both to clinical providers, so doctors, nurses, advanced level practitioners, and also the general public. And I think that's one of the most important roles that I have as a volunteer is helping to share and disseminate the new knowledge that we're generating about how to treat women with heart disease.
You know, out of all of these statistics that I hear, I have not heard that heart disease is the number one killer of new moms. Now, obviously, it's significant to be as healthy as you can, especially if you're planning to get pregnant or are pregnant. But talk about this statistic as heart disease being the number one killer of new moms.
Yeah, absolutely. And thank you for bringing up this really important topic. So, I'm sure many of your listeners are aware of some of the statistics that we've seen in the last few years about maternal mortality in the U.S. And what we've seen is that rates of maternal mortality are increasing, and they're actually higher than a lot of other developed countries. And when we dig deeper to look at the different causes, what we've seen is that over time, as we've gotten better at managing things like infections and hemorrhage, at the time of delivery, causes of death from those causes have actually decreased, whereas deaths from cardiovascular disease have increased over this time period. So currently, heart disease and stroke cause about 1/3 of all pregnancy-associated deaths. And when we talk about pregnancy-associated deaths, what we mean are deaths that occur during pregnancy or delivery or in the year after delivery from conditions that are directly related to the pregnancy. And so if we look especially in the postpartum period, which is when a lot of these deaths occur, the leading cause are deaths related to cardiomyopathy. And to be completely honest, most of these women do not know that they have either a diagnosis of heart disease coming into pregnancy. So that's, one population. And then the other population are people who, came into pregnancy with a healthy heart and they experienced a condition that was directly caused by pregnancy. So that would be something like peripartum cardiomyopathy.
How much have you discovered is lifestyle related as opposed to something related to the actual pregnancy? Young women are doing what young women and men are doing in their late teens and early 20s. Are we just not getting the information out to women about how important it is to monitor and maintain heart health, especially if you plan on getting pregnant?
Yeah, I think so. I think there's a couple of different things. I think the first thing is that we're probably not getting the message out about the importance of, preventative care, physical health, emotional health entering into pregnancy and during pregnancy and after delivery. And so when we look at women who experience heart complications during pregnancy or after delivery, what we see is that some of the risk factors are related to poor cardiovascular health. So, for example, we know that women who have high blood pressure, either coming into pregnancy or developing high blood pressure during pregnancy, are at increased risk, of having cardiac complications. So, really understanding if you have high blood pressure and making sure that it's under good control is really important. And we know that women with obesity are also at increased risk of cardiovascular complications. And we also know one of the other risk factors is being older, going into pregnancy. And so especially for moms who are 40 years or older, there is increased risk. Women are having babies at later ages, which I too am in that category. But it just means that paying attention to overall health is really important. And I would say the second thing to point out is also the importance of understanding what the signs and symptoms of heart disease are. And as a cardiologist, I see this a lot, and I talk to my OB colleagues a lot about this. So a lot of the symptoms of heart disease include shortness of breath, exercise intolerance, walking up a flight of stairs and, not being able to breathe as well. But women who are pregnant also experience this. And so, it's really important to talk about what are some of the symptoms that women should be looking out for and when to seek care, and also, doing some education with providers so that they understand, what is normal versus what is not normal in a woman who's coming in with shortness of breath. Now, chest pain is not a common symptom of pregnancy, and so certainly if anyone is experiencing, new chest pressure or discomfort, it's really important to talk to your medical providers.
Talk briefly about some of the resources that the American Heart Association specifically provides to support women so that they can have healthy hearts. And also talk about May being the American Heart Association continuing its second year of the Millions for Moms campaign, if you would.
Yeah, absolutely. So, the Go Red for Women campaign is committed to helping women in every stage of life and addressing heart health during pregnancy and the maternal mortality crisis is a particular focus right now because it really is a focus. And so on the Go Red for Women website, there are a number of resources available to women to help them understand what their heart risk is during pregnancy and after delivery, but even just as important, how to strive for cardiovascular health entering into pregnancy and during pregnancy. So emphasizing, the importance of exercise, emotional well-being, healthy eating, blood pressure control, things like that, and a lot of resources in terms of understanding what symptoms to look out for.
Great.
And then I just wanted to comment on also, the focus of the Go Red for Women campaign this May is on, supporting mothers and supporting heart health in new mothers. And so as you mentioned, again, this year, the Go Red for Women campaign and the American Heart Association will be focusing on raising money to support raising awareness and funding research to improve our understanding of heart health and heart disease during and after pregnancy and improving health for all women. And so I know for some people, who think about, what should I get for the moms in my life? For people who have resources, one thing that people think about is making a donation, in honor of someone. And so I would just encourage people to think about making a donation in honor of their mother or the mothers in their life that they know and support, so that we can, have more resources to understand heart disease and eliminate it.
And give us a website where we can learn more about the GoRedForWomen.org and make a donation.
I would encourage people to go to www.goredforwomen.org. And this is the main website for Go Red for Women, which provides resources for individuals, for patients, for clinicians, but also to make donations for Mother's Day.
Dr. Louie, it's been a pleasure speaking with you this morning. Thank you so much for this information. And I'm hoping that you have a great Mother's Day and good luck in all your endeavors. Thank you very much.
Thank you so much. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jennifer Louie. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.